Influenza, also known as the flu, is a common infectious disease. It is an RNA virus which causes respiratory infection in mammals and birds. Some symptoms include high fever, aches, fatigue, and potentially even death. However, there are ways in which you can prevent the spread of influenza, other than getting your flu shot. Did you know that just washing your hands can prevent oneself from getting sick? Hand washing is the single most effective way to prevent the spread of infectious diseases, as 80% of diseases are transmitted through touch. Since many people do not get the flu vaccine, the most important thing you can do to prevent getting the flu is to wash your hands. Some good hand washing techniques include using an adequate amount of soap, rubbing the hands together to create friction, rinsing under water, and drying them properly. Unsure of how long to wash your hands for? Just sing happy birthday twice, which is about 30 seconds long. Did you know that the method you use to dry your hands could have a huge impact on the bacteria found on your hands? This bacteria could lead to infectious diseases such as influenza. Warm air hand dryers are the most common method of drying your hands in public and workplace washrooms, but are they really doing a good job? Drying your hands to 95% dryness takes more than twice as long with a warm air dryer compared to a towel or an ultra-rapid dryer. Drier hands are less likely to become recontaminated by bacteria. Using paper towel as opposed to air dryers is an effective way to reduce bacteria levels on the skin, which in turn reduces the risk of influenza. Most studies suggest that paper towels can dry hands efficiently, remove bacteria effectively, and cause less contamination of the washroom environment. Another way to reduce the spread of bacteria is using paper towels to turn off the tap, as well as to open doors and avoid more transmission of bacteria.
According to Niagara Public Health, using hand sanitizer is one of the most effective preventative measures in reducing the risk of infectious disease. It's also a great substitute for soap and water when they are not available. Hand sanitizer is the most effective at killing bacteria and viruses when it contains 60 to 90% alcohol, such as Purell. Hand sanitizers are especially effective when placed communally in hallways and in front of washrooms, when walking from class to class in order to reduce the spread of disease. Implementing hand sanitizers in schools and educating students and staff about the importance of hand health will significantly reduce the risk of illness from colds and flus. Work sanitizer between fingers, back of hands, fingertips, and under nails. Rub the hands until dry for 10 to 15 seconds.
The hand sanitizer, sink, and both of the hand dryers are our way of honoring the This is Public Health campaign and letting students at Brock know how public health has improved their overall health and helped to reduce the spread of influenza.